This is Tony Neal in collaboration with cohort Denise Richardson. We are members of ASPEN and the Nutrition Support Nurses Practice section. Today, our topic is clinical questions when administering blenderized tube feeding. To provide a little bit of background before we get started, blenderized feeds have been around since the 1950s. It was at that time blenderized tube feeds were used in the hospital setting, but it wasn't until the 1970s that sterile formulas became available for use. BTF is made up whole foods that are liquefied in a blender and then administered via a feeding tube. There are clinical benefits with the use of BTF, including reduction in gastroesophageal reflux. However, this is not something that will be addressed in this program. But the objectives to this program are to address some clinical questions that arise when administering blenderized tube feeds. The methods of administration will be discussed and challenges to delivery will be reviewed along with solutions to the challenges. The ultimate goal of this presentation is to educate clinicians involved with BTF so that optimized patient outcomes are ensured. We have no disclosures, and any use of commercial brand images or names are for education purposes only. ASPEN does not endorse any type of particular brand. Here are three general categories of formulas. Commercial enteral formulas are not considered to be blenderized tube feeds. They are not whole food formulas, but are made up of synthetic ingredients. Since they are liquid-based, administration of commercial enteral formula is easily done via a syringe or a bag setup or a feeding pump. The second is blenderized tube feeds that are available commercially. The advantages are that these formulas have a longer shelf life than homemade blenderized tube feeds and are often more convenient to use. These formulas are a mixture of whole foods that are blended, then commercially produced and packaged. They have a higher viscosity than the first category of standard commercial formulas and may possibly require additional food recommendations or micronutrient supplementation depending on the individual patient's needs. Administration via syringe is the preferred and easiest method to give commercially available tube feeding. Although this category of formula can be given via feeding pump or gravity feeding, it is possible that dilution may be required to lower the viscosity. The third category of formula is homemade blenderized tube feed. As you see, this mixture of whole foods blended together. Whole foods include fresh produce, dairy, whole grains, meat, and fish that are close to original form with minimal processing. The foods are prepared at home by cooking them, then blenderizing using a powerful blender so the result is smooth enough to administer via a feeding tube. The high-quality, heavy-duty blender is needed for smoothness and consistency, which helps lessen clogging. The blenders can be very costly, and sometimes a strainer is used with a less sturdy blender to eliminate lumps in the home setting. Note, clumps or lumps represent calories that have not been given as ordered if they cannot be infused via the feeding tube. Many patients prefer this formula, some in combination with commercially prepared blenderized tube feeds, as they can get a variety of real foods, tailor the formula to their specific dietary needs, and also avoid food allergens or sensitivities. A downside to homemade blenderized tube feed is that it is more intensive as planning, shopping, preparation, and involves food safety practices. Patients are taught to routinely clean the blender as well as utensils and syringes that are used for blenderized tube feeds. As with any food preparation, all foods must be handled properly to reduce the risk of contamination. When making a homemade BTF, one must wash all produce carefully, cook foods to doneness, and refrigerate the unused portion promptly, and complete the feeding when it's hanging in no more than 2 hours. and we will discuss this later in the presentation. Some programs encourage freezing smaller portions to be used at a later time. Just like the commercially prepared blenderized tube feeds, syringe administration via syringe is the preferred and easiest method to give homemade BTF. Similar to commercially available BTF, homemade may require dilution to decrease the viscosity and ease administration. It must be noted here that a dietitian is involved along with the medical team to ensure adequate calories and fluids are met accordingly. Here is a list of some common questions to consider when it comes to blenderized tube feeding. Why is BTF so viscous? Will it clog a feeding tube? And what is the hang time for BTF? Is it a higher risk of contamination? What about the Enfit connectors? Can they be used with blenderized tube feedings? And can blenderized tube feedings be used via enteral feeding pumps? Okay, let's review those questions we just asked. Blenderized tube feeding formulas are thicker or more viscous. The thicker viscosity provides nutrient density and has been shown to help with decreasing gastroesophageal reflux, gagging, retching, vomiting, and dumping syndrome. These clinical benefits can be very helpful for many patients. A few things to keep in mind: if liquid is being added to thin the consistency, it is very important to avoid contamination when adding anything to either homemade or commercially added blenderized tube feed. Note some suggestions below. Of course, water is often the number one. We have kefir, milk, fortified coconut milk, oil, fruit juices. I've had bone marrow broth added to formula to help thin the consistency. The length of time that feeding can hang, or the hang time, is also shortened. And we'll talk about contamination and hang time later on in the presentation. One of the reasons for adding liquids to blenderized tube feeding, though, is to help with administration of the formula. Often the feeding is delivered by bolus method using a syringe or a large bore gravity bag. However, the clinical situation may warrant a slower, more controlled rate of delivery. Then an enteral feeding pump is needed. Clinicians may advise not to use any blenderized tube feedings with jejunal tubes, which will have a smaller diameter and because of the viscosity of the blenderized tube feedings may clog. Most clinicians recommend a G tube though, and manufacturers' guidelines vary greatly of the recommended sizes of G tubes. Some recommend a G tube size down to 6.5, all the way up to a greater than 14 French. It is important to check each specific manufacturer's recommendations on administration tube size and the enteral pump capabilities. But many clinicians do recommend greater than a 14 French gastro tube to utilize with blenderized tube feeds. One issue with feeding tubes in general, regardless of size and type of formula given, is that feeding tubes can become clogged, and then they are not able to be used till the clog is cleared. This can cause great angst and downtime till the problem is corrected. Common reasons that a tube becomes clogged or include medications, improper tube flushing, carbonated soda use, which can create or worsen a clog, or even break down the material of the tube. Slow infusion rates can cause problems, or formulas too thick or sticky, or with large particles to pass through the tube can also create problems. As with any feeding, it is important to flush before and after feedings and medications. Occasionally, again, if the rate is too slow, more flushing may be needed to maintain patency of the tube. Studies do show fewer occlusions or no occlusion problems with occlusions if the feeding tube is 14 French or larger. What is the hang time for commercial formula, blenderized tube feeds, and homemade blenderized tube feeds? ASPEN Safe Practices for Enteral Nutrition Formula Hang Time can be found in the Enteral Nutrition Practice Recommendations in JPEN 2009. This article includes sterile commercial formulas for neonates, powder formulas, or non-sterile additives, and human breast milk, which falls into the category of a 4-hour hang time limit. Therefore, the addition of additives to a commercial tube feed reduces the hang time from 8 to 12 hours, as noted in the article, in an open system to 4 hours. Longer hang times have been associated with increasing and unacceptable levels of bacterial growth. Commercial blenderized tube feed hang times vary from 2 to 12 hours, but you must follow each manufacturer's guidelines with these formulas to maintain safety. Homemade blenderized tube feedings, though, have a 2-hour max time hang. Is blenderized tube feed at a higher risk for contamination? As discussed in the last slide, there are important considerations to be followed to decrease risk of contamination with blenderized tube feeds. It bears repeating that in terms of safety, all items used to make formula are to be cleaned properly. That includes blenders, bowls, utensils, and don't forget the cutting boards used to chop meats and vegetables. Carol Ayrton Jones et al. In the Ole Lifetime Line letter in 2017 has an excellent article for patients and staff understanding all the nuances and safety concerns of homemade blenderized tube feedings. Either the food must be used immediately after preparing or must be refrigerated up to 48 hours. Best practice is to put in separate containers, canning jars, or even ice cube trays and freeze unused convenient portions. Finally, again, the feeding is to be completed by the 2-hour maximum hang time. Can blenderized tube feeds be used with the Enfit connector? As we are all aware of the Enfit safety initiative to avoid and eliminate misconnections, the Mayo Clinic and FDA, along with Guha et al., determined after doing a study measuring flow rates between the legacy or the original funnel-style connector and the Enfit, the results were largely similar, but a variance of 10 to 15 minutes may occur with Enfit. Educating your patients will alleviate anxiety and stress over any increase in feeding times. Again, it was recommended that a high-powered commercial blender be utilized to thin the consistency and reduce particle size in the homemade blenderized tube feed and ease the flow. When working with low-profile feeding tubes, though, use of the straight bolus extension is recommended over the right angle, and this will help eliminate clogging at that right angle site. Can blenderized tube feedings be used with an enteral feeding pump? The short answer is yes. Studies have been shown blenderized tube feeds can be infused via pumps. It is important to be aware that pumps may not have gone through testing for the more thicker blenderized tube feeds, and variances can occur. Refer to your pump's manufacturer guidelines. Since home blenderized tube feeds can only hang for 2 hours, as with some commercial food blends, just be aware of any variances in your pump with thicker formulas. Again, educating staff and patients will alleviate anxiety and undue stress. As mentioned, dilution may be needed to help thin formulas to ease and smooth the pumping process. Any liquids added should be done just prior to infusing. Also remember, dilution now changes the ratio of calories to liquid. Patients should consult their clinical team. Adding diluents will increase the volume depending on the dilution. It may increase or decrease calories and increase or decrease blood sugars. How do these additions of dilution affect your patient? One challenge that may occur while using a pump for blenderized tube feeding is that small particles of food can be stuck in the tubing or cause a blockage at the exit point of the bag. When this happens, your pump will beep and stop pumping or may alarm low flow error message. Patient advocacy groups such as the Ole Foundation and the tube feeding awareness groups, along with their patients, continue to offer suggestions when challenges as these occur. One suggestion was to have the bag inverted, laying next to the pump, so as the larger pieces will float down and not get drawn into the tubing. Any air left in the bag, though, would rise to the top and be drawn into the tube, so this process must be done with all air removed. Now, a slower infusion rate may cause the formula to become thicker and cause the pump to alarm. It is important to note that depending on the clinical situation, a higher volume and slower rate may not be feasible. I want to end this question not to deter you from blenderized tube feedings, but to educate you as a clinician to be aware of challenges that could affect your patient clinically. My colleague encountered this with her 3-year-old status post bone marrow transplant just off of TPN for about a month. She was on this since birth. Mom realized the pump this morning after an unidentified period of time that the pump could not handle a commercialized blenderized tube feeding. Name not disclosed, but it was at a rate of 83 mLs per hour. Now this is not a low rate, which is something we have already addressed. The outcome, though, changed the child's weight, dropped it down 2.2 pounds or 1 kilogram. Now we know weight losses in children is a challenge. And our point just here is to monitor your patients carefully, as with any novel endeavors. If we are aware of these potential situations as we monitor our patients, changes to care can be made to improve desired outcomes. As discussed in the previous slide, blenderized tube feeds may need to be thinned with 2 to 8 ounces of additional fluids, which some options and suggestions have already been offered in a previous slide. And this also must be done right before the infusion. Vigilance is recommended, keeping in mind decreased calorie intake if water is used. This increased volumes. Can your patient's condition handle more fluid, especially if the rate is increased? Also consider contamination issues, which can occur when manipulating formulas. Remember to remove air bubbles from enteral bags, especially if we were talking about that previous inverted method, or if you're hanging the bag in a backpack, so as not to have bubbles enter into the fluid path and enter the GI tract, causing fullness, burping, or bloating. Prime the tubing and set the desired rate, noting any variances that can occur with your pump. Flush tubing before and after feeds, and of course with medications, with 30-60 mLs of water or as prescribed. Once the tubing is primed, if it's attached to the pump, hit run. If you've primed it off the pump, connect it and then hit run. And remember, administration sets need to be discarded every 24 hours. What about blenderized tube feeding and the popular gravity administration? Large bore gravity feeding bags are preferred. Again, the formula may be needed to be thinned with 60 to 320 mLs of fluid as recommended by your clinical team. Gravity bags are also changed or replaced every 24 hours, and you must do the same with flushing with 30 to 60 mLs of room temperature water before and after infusion, or as prescribed if more water is needed. Malone et al. In the Enteral Nutrition Handbook discussed the ASPEN guidelines for enteral gravity infusions. And adults can range from 20 to 60 mLs of gravity infusion rate. In pediatric patients, usually the suggested rate is to infuse over 120 to 180 minutes. Now, these times may vary depending on the volume of the formula and the patient's tolerance. Besides gravity bags, what else can be utilized for bolus administration? We have the 60 ml syringes now with Enfit tip, but we still have the catheter tip syringes for the remaining legacy feeding tubes, which can be utilized. Again, utilizing the appropriate syringes will prevent misconnection errors and possible sentinel events or death. Safety is ever paramount in patient care. In utilization of either syringe, the Enfit tip or the catheter tip had a non-significant difference in syringe bolus. If using the push-pull method to feed, pull or draw the formula into the syringe and slowly push, or remove the plunger and pour formula directly into the barrel of the syringe and allow gravity to flow the formula slowly through the tube. The slow method should take about 10 to 30 minutes to administer an 8-ounce fluid of formula. Again, this can be referenced in the Enteral Nutrition Handbook. These are only suggestions and should be utilized according to your patient's tolerance. What are the precautions one should take with traditional commercial tube feedings and blenderized tube feeding formula administration? Medication precautions should include not to add any medications directly to the tube feeding. All medications must be crushed or dissolved completely mixed with water to make a slurry. Best practice possible is to use the already liquid form of, or suspension form of meds. Never crush an extended release medication. Also be aware what is the correct location to deliver medications. Remember not to administer medications as carafate into the jejunum via J-tube when it needs to be absorbed in the stomach via G-tube. Another precaution I want to address is the variance in formula size containers. Some may be obvious. The common size is about 250 mLs, but sizes in the Tetra packs can be as large as 325 mLs. I have had patients tell me they transferred to a blenderized tube feed but was unaware of the size variances and was gaining more weight than wanted. But they were re-educated to infuse the specific milliliter amount versus the container amount per day. And what I'm saying is, don't teach your patients to infuse 4 containers of formula a day when they don't equate to each other. We should be educating our patients to take how many mLs per day so they're aware of how to break that down. This calorie content certainly varied. Be aware of under or overfeeding your patients, as these possibilities and other metabolic complications can occur. When would one consider commercial blenderized tube feedings? Some patients may opt to try a combination of blenderized tube feeds along with homemade tube feeds. There are a few reasons patients may want to try this. Homemade does offer the patients to have foods they have become to enjoy and may give them satisfaction, again while reducing patient allergies and sensitivities while choosing some of their own foods. What effect does real food have on the intestinal tract as far as colonizing healthy bacteria and maintaining a healthy GI tract? These can also be found with commercial blenderized tube feeds, which have a longer shelf life and do not require refrigeration prior to opening. There's no risk of preparation contamination with commercialized blenderized tube feeds. Also, you avoid the time-intensive prep and refrigeration. You have consistent nutrient delivery, whereas homemade blenderized tube feeds are not reimbursed or covered by insurance, whereas commercial blenderized tube feeds are often covered by your insurance company. Our goal was to review the different categories of enteral formulas and highlight questions that may arise with the growing popularity in commercial blenderized tube feeds. Methods of administration and challenges you may encounter were also discussed. Having the clinician more aware of these pearls will improve the ability to discuss and offer best practice suggestions for your patients.